Everybody? It's me, Jamal from the Jamal Cast. I am sitting here. Today is Saturday, the 31st of August. It's Labor Day weekend, and I thought I would sound off about healthcare. I don't know if this video is going to go up today because I'm a little pissed, and I want to reflect and make sure that my pissness doesn't screw up my message. But my message nonetheless is important, so I'm going to try to record it now while I'm feeling it. Healthcare is really important to me. First of all, I worked in healthcare for a while. I ran a medical center in Chicago, specialized in treating folks that were suffering with HIV and AIDS and other chronic infectious diseases. So it was really important work. And it was at a really important time in the organization's history because the organization was struggling, almost about to go out of business. There are a whole bunch of scandals and other issues that we had to fix. And we did it because we were concerned about the people's lives. At the end of the day, we had a big fundraising campaign called the Lifeline campaign because really that health center had become a lifeline for so many people who had nowhere else to go, at times when they had nowhere else to go and no one else to go to. So I understand the importance of healthcare. We serve like 40,000 patients, had a bunch of doctors and mid-levels and all that kind of stuff. So I get how difficult the work is. I get how important it is. And I remember sitting there when we were doing that, which, by the way, that's a whole nother topic for the Jamal Cast, that whole experience, because as important as it was a crazy experience. But, I remember sitting there looking at clinical protocols and staffing, dealing with staffing issues, funding issues, insurance issues, and things like that, making plans that we really knew they were the best that we could do under the circumstances, but they really weren't what we needed to be doing. They weren't the best things for the patients. They were the best things for the patients under the circumstances, given the law and the rules and the funding and the insurance and all that kind of stuff, Medicare, Medicaid, all that stuff. But at the end of the day, it wasn't really what was right for the patients, the overall wellness of the patients. It was, we're dealing with infectious diseases and treating symptoms and responding and reacting, but not actually being able to do a lot of preventative care and wellness care, which is what we really wanted to do. And eventually, I believe the organization has gone on to do some more of that stuff, which is great. But today I went to go get a prescription refill for my son at Walgreens, only to discover that the insurance company, Blue Cross Blue Shield, PPO, the platinum plan, whatever the highest level plan we could get through my firm, was requiring some additional authorizations for them to pay for this medication that he needs. I'm not going to go into his conditions and what he needs and why he needs it, because that's really none of your business, although we may talk about it at some point. But the insurance company was asking for all these additional steps and reviews. Now, what's weird about this is that this is for a reduced dosage of a medication that he was having some adverse reactions to. So when we saw his doctor, we agreed to step it down to see if that was going to make it better. So what was odd is they're saying they want some further authorization or review. I just got off the phone with the supervisor, whoever is in charge over this holiday weekend, saying, well, the plan needs to review this, and because this is a controlled substance and there's a change and we need to make sure the change is what he needs. Well, number one, the insurance company, you're not his doctor, so you don't get to decide what he needs. And number two, his doctor who wrote the prescription has already decided what he needs. And number three, this is the same medication he's been on for several years that he was having an adverse reaction to. So it's a reduction in dose. It's the same stuff they approved and literally paid for like 2 weeks ago. So what's the point of this prior review? And it makes me think about how these insurance companies and really how our healthcare system is set up, where it's not really about what's best for the patient. And it's about what's best for them. It's about what they think is best for the patient, but it's not about what's best for the patient. It's not about healthcare. It's about symptom treatment. It's about benefits management. The woman, literally, when we were on the phone, she's like, well, I'm in charge of the benefits and something. I'm like, well, I understand you want to call this, but this isn't a benefit. You're not doing me a favor. I paid for this. Okay, my firm, I own a quarter of it. So, and as a partner in any law firm, or the big ones I've been in, the small ones, whatever, you're a partner in a law firm, you pay for everything anyway. So at the end of the day, my employer didn't do this for me. This isn't something I'm just lucky and privileged to have for working my 40 hours. And they sure as hell aren't doing anything special for me because I pay them and handsomely on purpose to avoid these kind of issues. But here I am sitting here on a holiday weekend trying to get some medication for my kid whom I love and who needs it. The adjusted dosage so that he doesn't have another allergic adverse reaction to it. And I'm getting hassled by the insurance company because they want to substitute their judgment about what he needs and why he needs it. And they want to review it, even though I've obviously reviewed it. His physician, who knows him and has been treating him, has reviewed it. And of course, they've already reviewed it before because they approved the higher dosage and paid for it 2 weeks ago. What the fuck is that? So now I know with the political elections and all of the discussion going on right now, particularly with the presidential elections, there's a lot of talk about healthcare, Obamacare, Medicare for all of that stuff, and everybody has different points of view on it. But I want to question really where those points of views are coming from. Because most of them, at least in the case of the healthcare for all, universal healthcare, single payer, Medicare for all, some of those people, I think at least, are coming from the place of saying, let's make sure everybody has access to this. Because, I'm bitching about this, but at least I have access. I mean, I've got great insurance, one of the better plans. We've been to some of the best hospitals, walking into Walgreens, getting whatever we need to get most of the time. And there are other folks who can't even get a Medicaid card, let alone any other kind of coverage. The folks that are obviously not getting anything from their employers, the folks are trying to buy stuff on the healthcare exchange and it's too expensive and all those kind of things. And our response to that is all about money. It's all about, we need to do away with Obamacare because it's costing businesses too much money. We need to not have single payer healthcare because it'll shut down the private insurance market. I haven't heard anyone actually advance an argument about healthcare reform that says we should not do this because this is not best for patients. This is going to help make our country healthier and happier and improve the outcomes and the quality of life for most people. And quite frankly, I think a lot of folks that are opposing this, opposing access to healthcare, whatever route it is taken, are folks who would prefer to see folks struggle because that's how they stay ahead. It's scarcity thinking. I think we talked about that, or I kind of chimed in on that with the repost I did with Jada Pinkett Smith. Scarcity thinking. I can't get ahead unless I keep you down. I can't be successful and rich and famous or keep money in my pocket unless I keep it out of yours. I can't be in charge and powerful and all the things I want to be unless there's some folks who don't have access to what I have access to. Because of course the folks that make the decisions, the United States Congress, they have wonderful benefits. The President of the United States, wonderful benefits. But the people that elected them don't. There's a problem with that. And I think some folks want to keep it that way because they like the idea of keeping some folks down because they're afraid of what happens when those folks get up. That's scarcity thinking. That's fear. That's not love. That's not compassion. That's not kindness. But, for me, in the privileged position I sit to be sitting here having to argue with Blue Cross Blue Shield about whether or not my son can get some medication they already approved 2 weeks ago at a higher dosage, I just think that was kind of the tip of the iceberg, straw that broke my back, because I think it's bullshit. So I had to sound off about it. Now, I want to encourage you guys to stay active and involved in your politics, these debates, and importantly, these elections, because this is the kind of stuff that gets decided at those levels. And you need to be involved and you need to be informed, because if I'm struggling with it, then think about what's happening to some of the people that are not as privileged and as fortunate as I am, as many of you are watching it as well. That's my 2 cents.